Pushing joint replacement to the next level is going to start with our research. With publishing over 100 papers, peer-reviewed publications each year, we're at the forefront and we're the leaders in orthopedic research. We do 17,000 hip and knee replacements across Rothman each year. So being able to do more volume, that's leading to better patient outcomes. Every one of my colleagues is an expert in hip and knee replacement care. We have 5 members that are members of the Hip and Knee Society. We have past presidents of our subspecialty organization. Being on the podium, it's writing papers, it's collaborating with my colleagues who are leaders in their field. That's the biggest thing that I like about being at the Rothman Institute. We know following evidence-based guidelines helps improve patient care. So whether it's the medication that we're going to give you as part of a perioperative pain protocol to help minimize your pain both before, during, and after surgery, whether it's our rapid recovery protocols, getting patients up, out of bed, and out of the hospital many times the same day of surgery, that has been linked to more successful patient outcomes. We are the leaders in hip and knee replacement, not just here in the Philadelphia area, but across the country. We're going to continue to be leaders in research. We are going to continue to have the top fellowship in educating the next generation of surgeons in this country. And most importantly, we're going to continue providing top quality patient care to all of our patients.